Good evening. We are now faced with a second wave of this COVID pandemic, and a lot of people have been asking questions. We thought we had done extremely well. In Kerala, we are coming probably to the end of the first wave, as it's called. So I've got with me panelists who would like to answer some of these questions. Dr. Sangeeta, Dr. Joseph John, Dr. Abel, and Dr. Arun Sachu. I'm going to ask them some questions that you have asked me, so that with the answers, we'll be able to understand things a little better, and it'll also help us respond in such a way so that at least in Kerala, we won't have a second wave and we will protect our people. I'll start with the question to Dr. Joseph John. Why is the current phase of the pandemic, why is it called the second wave?
Thank you. While we don't have a very clear definition of a second wave, the Association of Schools for Public Health in European region has given us a broad outline with a definition stating that a second wave is a resurgence of an increased incidence rate of a pandemic. This would present as an exponential rise in the numbers of the COVID-19 cases during a specified period of time and carried on thereafter. And this would be confined to a specific territory. Now, this increase would follow after a near total disappearance of the infection or a total disappearance. So, an increase in the number of cases, which is characterized by a certain behavioral change on the part of the virus, or a modified character that the virus acquires to what has already been previously known, so that it can override and overcome whatever barriers are present. So that would in general define a second wave. Now, as to the fact whether we are in a surge of a previous wave or whether we are actually onto a second wave would be taken in a different sense by different people. Whether it's just semantics or not, we do not know, but it would certainly mean that we are faced with a new threat. However you interpret it, the response has to be geared to the problems that we face, and our decisions may have to be modified and our plans may have to be made to counter this seemingly great threat that confronts us.
Dr. Sangeeta, could you enlighten us once again on what is R0? And also, could you explain to us, is it because, as Dr. Joseph John said, has it not spread all parts of the country? Did it get confined? Is that the reason for the second wave?
True that there was a feeling at the end of 2020 that COVID has already swept through large parts of the country, and that the seroprevalence was high and there was some degree of herd immunity. But ICMR, in its third national survey in December-January, reported that the seroprevalence is just 21%. And we know that we've been saying that we have acquired herd immunity, but to tell you that experts say that 70% is a threshold for herd immunity. So by December-January, if the seroprevalence was 21%, now it will be almost around 30 to 35%, and that is nowhere close to what is required. And when telling of R0, it is the basic reproduction number of the virus, that is how many people it can infect when one person is infected. So I don't think that the virus had swept through large parts of country as initially thought, and still we are a long way to go in acquiring herd immunity through vaccination.
So that means you are saying that there were several areas in our country which did not, or people did not get infected in large areas in our country. Is that right? Okay. So it is not right that some people feel that the spikes are being seen in areas where the testing is increased.
Definitely, our testing rates have increased when compared to the first wave of the pandemic. But we cannot say that the increase in the cases that we see now is due to increased testing alone. Definitely, it is due to more transmission, as the upward trend is quite clear in terms of the number of cases that are being admitted, the number of reported cases of symptoms, as well as the variants of concern, that is the new emergent strains of COVID-19, that has all led to an increase in the number of cases. So I don't think that the spike in cases is just due to increased testing.
Now, in our country, the mortality rate has come down significantly. So, does it automatically mean that we are not seeing that virulent infection? Or what is the reason why the mortality is relatively low this time?
When talking of mortality, I think there is a theoretical reason that this could happen. When the virus has nearly exhausted a large number of susceptible hosts in its first sweep, and in this phase when the vaccinations are being rolled out and a lot of people are vaccinated and some of them are still using masks, the virus is finding less people to spread to. So it can become more infectious but less virulent, I would say, because it does not want to wipe out its own existence by the death of its host. So what I think is, for its own survival, when it does not find lots of hosts to move on, it has to reduce its virulence, and that might be one of the reasons why we find a less mortality these days. And also what I would say is, now we are more equipped with the healthcare facility is more equipped to combat the COVID-19 infection as well. So that might also contribute to a decrease in the mortality.
I would like to add on to something that Dr. Sangeeta has told. When comparing with the states of Kerala and Maharashtra and now Punjab and Delhi has joined now. So if we compare the case fatality rates of Kerala, it's just 0.4. And if we compare it with Punjab, it's 3.2. And Maharashtra, it's 2.4. So when we compared what is happening, what the state is doing, what the state of Kerala is doing, they are catching early. The facilities for testing is more, or they are doing more tests, and so they are catching the people early, and that also contributes to the decreased mortality as predicted by many epidemiologists.
Thank you, Abel. I understand that the vaccination program in Kerala has been quite good. The Believers Church Medical College Hospital under your leadership has done extremely well. What does it do in terms of epidemiology, in terms of the disease itself? Do you feel you are able to contain the COVID infection?
Sir, I think there are two parts to your question. That is, one, whether vaccination can arrest the spread of COVID-19. And the second question would be, what impact does COVID-19 vaccination have on the variants, right, sir? Yes. I would say that to a certain extent, definitely vaccination can arrest the spread, but vaccination alone is not sufficient. The first reason I would say is, because vaccination takes time. As you all know, we require 2 doses of vaccine spread at 6 to 8 week interval. And after 2 weeks of the second dose, we are going to mount an immune response. So by this time, the pandemic can reach explosive levels because 2 months and more is a good time. Second, because of the emerging new variants, we cannot say that the person will be completely protected against COVID-19. But definitely the incidence of mortality and serious diseases will be less when we take vaccine. So what I would say is that in order to arrest the surge in cases now, COVID-19 vaccination coupled with the COVID-19 precautions that we had earlier will succeed. Now, the second part of the question I would answer is the COVID-19 vaccines definitely they have an impact on the new emerging variants as well. The studies are undergoing now to study what is the level of protection that the vaccines will offer to the variants. But one thing I would like to add is that vaccination is a process where a broad immune response is elicited. It is just not the neutralizing antibodies, but a vast array of host immune responses such as the B cells and T cells are all involved. So it is generally hard for a virus to overcome this variety of different immune response mechanism all working in unison to combat the virus. So the new variants definitely would be addressed by the vaccines that we have right now. But in the future, the COVID-19 vaccines will have to be modified by incorporating new viral strains as well, and booster shots may also be required in future.
Dr. Joseph John, are you seeing less virulent forms of the disease now? As over time, are we seeing that the patients are doing better? Are the pneumonias and all that, is that less than before, or the breathing difficulty and the oxygen saturations? Are we seeing milder forms of the disease now, or is it still the same?
Thank you. We are certainly seeing a lesser number of patients, and all in all, we are not seeing as many severe patients. Nonetheless, there are people with severe disease too. Whether we know now better than what we were used to earlier, and whether the interventions at the right time have sort of thwarted or negated the complications to a certain extent, that would also have a bearing as to why we don't see as many. But I should say that we do have patients with complications, but because of the seemingly lower numbers as of now of COVID-19, we definitely have a lesser number of complications also. But we do see them sometimes.
I guess we don't know enough to say who are the ones who are going to get worse. Is it the quantity of the virus? Is it the virulence of the virus? All these are questions that are being investigated. Dr. Arun Sachu is our expert in microbiology, virology, and he's been working on this, reading up quite a lot. I have 3 questions to ask of Dr. Arun Sachu. What is an escape variant of SARS-CoV-2? What are the concerns that we have about these variants? And what is a double mutant?
First of all, variants of concern as defined by the CDC are those which are associated with increased transmission, possibly an increased death rate, and as well as reduction in the neutralization by antibodies, and as well there will be reduced response to vaccines. And an important mention is that there may be a diagnostic detection failure by the routine PCR mechanisms. And among the variants of concern which is defined by CDC, there are 4. That is the UK or the Kent variant, which has absolutely swept through the United Kingdom, which has resulted in a 50% increase in transmission, and there are reports of a 30% increase in fatality as well. And also the others but the good thing about the UK variant is that the Covishield vaccine seems to work well against the UK variant, whereas the other two of major concern, that is the South African and the Brazilian, the vaccine has got limited efficacy. And the other one is, of course, the one in the United States, that is the California variant. Now, the problem with in India, there are reports that now there are around 700 UK variant strains, and in 700 samples as well, now 36 South African variant and 1 Brazilian variant so far, which have been sequenced, identified. Now, the problem with another problem is the double mutant variant, which has now been found in several places, and in Kerala there are reports of 123 samples identified with the double mutant variant, that is 2 mutant strains coming together to form a third variant, that is known as the double mutant. Now again, the problem which has not been addressed, I feel, is that whether the PCR test that we do, that is, for example, the TrueNat or the Gene Expert that we do, can it detect these double mutant variant? And if not, that would be a major concern for us, as it is clearly be mentioned that in Kerala, out of the 14 districts, 11 districts, there's already the double mutant has been found. So can we still depend upon these routine tests like PCR or antigen to detect those mutants? Clearly needs to be further defined, is what I would say.
Dr. Sangeeta, why do these escape mutants occur, and what is the environment that triggers this off to evolve into an escape mutant?
As you all know, all viruses evolve over time, and COVID-19 virus is no different. When a virus replicates, it will undergo some mutation. A virus with one or more mutation is called as a variant. So the more opportunities it has to spread, definitely the more it will replicate. And the more it replicates, the more opportunities it has to undergo mutation. So what I would say is that stopping the spread of infection is the only way by which we can prevent the emergence of these double mutants and other variants. And another question that Sir asked is, what sort of environment triggers the SARS-CoV-2 to evolve into an escape variant? Suboptimal immune response is one mechanism which gives an opportunity for the development of these escape variants. But we do not know what level of suboptimal immune response equates to the high risk of the virus evolving into a successful double mutant or an escape variant. For example, in immunocompromised individuals, the viral infection, the COVID-19 infection may last long, weeks or months, and that time maybe there is an opportunity for the virus to develop into an escape mutant. And another scenario which is quite scary is that people with suboptimal immune response may be the ones after their first dose of COVID-19 vaccination. They might not develop a sufficient immune response to combat the virus, but the virus at that point of time, when a person is infected during this interim period between the first and the second dose, the virus is undergoing a selection pressure which can lead to a development of an escape mutant. But as I had told earlier, it is unlikely after vaccination, because vaccination involves inducing a wide range of immune responses, not just antibodies. So it is difficult for the virus generally to evade all these different immune responses that is induced by vaccination.
Looking ahead, I have questions to Dr. Abel and to Dr. Joseph John. And Dr. Abel, will a lockdown be a good idea to curb the second wave? And to Dr. Joseph John, looking ahead, how should India respond at the public health level, and at an individual level, what should we be doing?
Thank you, sir. So, lockdown, it depends on what is the intention of the lockdown. The government of India has proposed a lockdown with the aim to halt the process of break the chain of transmission. But we can see that after the lockdown, the peaks were there, and the intention was not achieved. But in an epidemiological point of view, we were able to stagger the cases, and that gave time to prepare for the ICU beds or the first line centers, procure medicines and even vaccines. So it depends on what is the intention of the lockdown that will help us to plan for a lockdown. Thank you.
So now regarding your questions as to what India's response ought to be. To know that, we should realize what the impact of a resurgence of an infection would be. In the hospitals, whether we would again be overwhelmed, lack of beds, lack of ICU spaces, lack of ventilators, lack of medications, lack of PPE kits and protective devices. All these are very critical issues that could confront us. Regarding what the public would face, would it be disruptions? As Dr. Abel said, would it be lockdowns? Would they again prey on the resources not only of the government but of each individual? Will the families be reduced to penury, or whether it will be difficult for what impact would it have on the mental health and the makeup of its citizens? What about the elderly? Would they be deprived of the necessary medical help that they ought to get because of the fear that this disease generates? What about for children? What would be whether the other immunizations which are so essential for them and for prevention of other diseases, would they be sidelined? Would the elderly again who are in care facilities, would they again have to bear a brunt of the disease if it were to again resurface without appropriate care? Would there be caregivers for them in such institutions, or would they be laid low by the infection? All these are all these fears. We do hope that they never come. We do not come to such a situation that we are confronted with these issues. But these are definitely individuals and as hospitals and as institutions which take care of the elderly. All these issues could always confront us, and we ought to be really geared to all these problems and have some solutions as and when they arise. We should be naturally prepared even beforehand, before these situations ever arise. Now, what would be the response of the government to? Will the institutions again with the public places be closed down, or whether they'll be functioning at a lower levels with minimal staff? Per se, I would suggest that we have already gone through the problems that a lockdown has brought. Whether it is, we should not wait for a surge before we impose a lockdown. Rather, we should use the lull that we have now to get into a preparation mode, to see that we are really conversant with the details, conversant with what we would require if such a situation should ever arise, rather than plan for a lockdown later, because there are many social issues that could arise from a lockdown, and that is not the answer to the problems that we would ever face. Rather, we should function at a low key. We should prepare during this lull for the storm that may come. Regarding schools, again, that is whether students would again lose out on the especially those in the 10th grade, 11th and the 12th, and those preparing for other exams, those desiring to go abroad for further studies, whether it will again impact on their plans. That is a definite concern. The immunization schedule for at least COVID-19 infection should go on a war footing. But by and large, not only the citizens, but the government should realize that the next surge will not be driven mostly by the mutant strains. The mutant strains are there, they could be contained with a proper vaccination, with a very appropriate public behavior too. Because what is going to drive the next surge is not the mutant strain mostly, it's going to be the public behavior and how we behave, whether it's an appropriate behavior that we exercise as we have been taught. The physical distancing, masks, hand washing, taking care of the elderly at home appropriately so that we do not bring the disease to them. All these, and a proper vaccination drive, all these would help to blunt the next surge. But all these, we have just a small window of time. We should utilize this window appropriately. Should we lose the chance, then we'll be faced with a major problem, a health issue, which would be greater in severity in all aspects, in terms of the numbers, in terms of the mortality, in terms of the morbidity that is caused, in terms of paralyzing the normal life. All this would be dangers that would confront us. So these would be certain issues and how we should gear ourselves to the problems that we confront.
Friends, we put this discussion together really to try and help you. We are concerned about what's happening in the country, what's happening in the world all over with the second wave, with the variants, and I'm sure all of you have a number of questions. We try to answer some of them, but the most important thing is for us to be confident and to move forward. First of all, take your vaccinations. Don't worry whether it's Covishield or Covaxin. Take the 2 doses, and as quickly as it's available to all of you, please take them. We just hope that the vaccines will be available for everyone within the country. That seems to be the best answer. Along with that, please continue to use your face masks, continue to wash hands, use sanitizers, and practice physical distancing as and when required, so that we try and ensure that people don't get infected. And with the vaccination covering more and more people all over the country, we will have the immunity that will prevent the disease from affecting our people. Because it's not possible to prevent people from coming in. A lot of people come into India. Some countries have succeeded by preventing anyone from coming into the country. Even in our own state, it's just not possible. Therefore, the preventive measures for us would be to be careful, to follow all the norms that have been clearly told to us by the government, and also to get vaccinated as quickly as possible. We hope and pray here, all of us at the Believers Church Medical College Hospital, that the second wave will not happen and that we'll be able to see an end to this pandemic very quickly. Thank you so much for your patient listening.